The four sets of paired extrinsic muscles are the styloglossus, hyoglossus, genioglossus, and platoglossus.
The styloglossus muscle lifts the lateral edges and retracts the tongue, while on the other hand, the hyoglossus muscle causes retraction as well as depression of the tongue.
The genioglossus protrudes the tongue, while the platoglossus elevates the posterior part of the tongue.
The former three muscles are innervated by the hypoglossal nerve, whereas the platoglossus muscle is innervated by the vagus nerve.
The temporalis muscle is primarily responsible for facilitating the act of mastication. The muscle helps in moving the lower jaw up, backwards, side to side at the temporomandibular joint. These movements collectively help the jaw in biting and chewing food in the mouth.
The masseter muscle is one of the four muscles responsible for the action of mastication or chewing. When the masseter contracts, it causes a powerful elevation of the mandible, causing the mouth to close. Being a masticatory muscle, the lateral pterygoid aids in chewing and biting actions by controlling the movements of the mandible. Bilateral contractions of the left and right lateral pterygoid muscles result in translation and rotation within both temporomandibular joints. Due to its posterior-inferior direction and the fact that its mandibular attachment is always mobile, the medial pterygoid muscle can exhibit several actions. Unilateral contraction slightly medially rotates the mandible, and bilateral contraction which elevates the mandible. This action, when combined with bilateral contraction of the lateral pterygoids, protrudes the mandible.
The prophecy is true.
The trigeminal nerve is the fifth nerve under the muscle of mastication.
It's a motory and sensory nerve, controlling the cranial and mastication muscles. It's also responsible for the sensations of the head, neck, skin, face, oral cavity, teeth, and tongue. Common carotids come from the aorta and split into the internal and external arteries.
The internal carotid artery supplies blood to the eyes and brain, while the external carotid artery supplies blood to the face and mouth.
The skull or cranium is made up of two parts, the viscerocranium and neurocranium, and is composed of 28 bones, with 14 facial bones, 6 middle ear bones, and 8 neurocranial bones.
Alright, the salivary glands produce saliva and maintain the integrity of tooth surfaces. Saliva lubricates teeth and helps digestion with an enzymatic process. Tooth surface maintenance requires a process of remineralization.
The three salivary glands are the parotid salivary, submandibular salivary, and sublingual salivary glands.
The parotid salivary gland, the largest gland, lets saliva into the mouth through the parotid or sentence duct.
The submandibular salivary gland releases saliva through the Wharton's duct, finishing the sublingual caruncles.
The sublingual salivary gland releases saliva into the mouth through the sublingual or Bartholin's duct.